Welcome to Listening to Lancaster. It is my pleasure today to be here with Union Community Care. Before we get started, I want to thank our sponsors, Michael's Motor Cars, for their support of this program and ongoing support of Hourglass. So thanks to Michael's Motor Cars. So today I am with Alisa Jones and Jackie Concepcion. Thanks so mumuch for being with me today.
Thank you. It's a pleasure.
Excellent. Yes, it's our pleasure too. So we just love the opportunity to be able to highlight the good work that you all do in Lancaster. And I'm hoping that maybe you could tell me a little bit about Union Community Care and the work you do in our community.
Absolutely. Well, Union Community Care is a federally qualified health center, and we are composed of two wonderful organizations that have merged, Lancaster Health Center and Welsh Mountain Health Centers. Both organizations have a 50-year history in Lancaster and Lebanon counties. So coming together, we have over 100 years of experience serving the vulnerable in our community, primarily with physical health, dental services, behavioral health, and social services.
Wonderful. And you both were federally qualified health centers. What does that mean? How does that differentiate from, let's say, a hospital?
Mm-hmm. So a federally qualified health center is also known as a community health center. And a community health center is really grounded in principles of being, number one, locally controlled, and number two, being nonprofit, and number three, serving everyone regardless of ability to pay. So that's really important to our mission, to ensure that no one has to make decisions about whether they feed their family or get healthcare. So that's how we're different. So, really locally grounded. Our board of directors is made up, over half of our board of directors are people who use our services. So, we are locally controlled, locally governed, and really focused on the most vulnerable in our communities.
Wow. You talked about your merger of your two organizations. What prompted that? And what are you able to do together that you were not able to do separately?
So I'll talk a little bit about the merger in some of the details of the merger, but then I'm going to ask Jackie to really talk about the impact on the community. So as you can imagine, two organizations in Lancaster County and then Welsh Mountain serving Lebanon, there were a lot of opportunities to achieve economies of scale, to be more efficient in the provision of services, and to make sure that we're using our scarce resources wisely. So by coming together, it really made a lot of sense to look at the needs of our community holistically, because there were parts of our community that were not being completely served by either organization. So by coming together, we knew that we could do more. And at the end of the day, the timing could have not been better, because we began our merger conversations in December of 2019. So we decided to move forward with real due diligence and a lot of detailed work around the merger right before the pandemic hit. And to their credit, our boards of directors decided that the pandemic was not going to delay moving forward, because if anything, it showed that the gaps and the cracks in our healthcare system were more dire than ever. And so the reasons to merge in order to be stronger as one community health center really spoke to us and continued to speak to us during this pandemic. So we moved forward.
Wonderful. That's great.
And I think if I want to add a little bit to that, would be that we at Welsh, formerly known as Welsh, served primarily the northern Lancaster County, eastern part of the county, and Lebanon County. So we had these two counties. We were small, resources were scarce. And when Alisa and I decided to talk. The main focus of our conversation was around how can we better impact our communities? How can we better provide services, especially to the most vulnerable? How can we address disparities in healthcare, social determinants of health, and how can we do that better as one organization, serving Lancaster City, the county, and also Lebanon. So that was, I think, a crucial part of our conversation in moving forward with the merger.
Mhm.
You mentioned those social determinants of health. Can you talk a little bit about what those are, and how that influences caring for the most vulnerable in the community?
So we're familiar with that. A portion of the community, has other needs other than, healthcare needs. They have food insecurity, they have transportation needs, they speak various languages. So language barrier can sometimes be an issue. Addressing housing, addressing a lot of those core principles that prevent people from becoming healthy. So what do we do about that? In a 15-minute visit with your doctor when you have a stomach ache or a virus or you're sick, because you're going back to that environment. So what we have been able to do in a federally qualified health center is create sort of a wraparound system that supports people when they come in for those medical dental needs, and say, okay, well, how can we better help you become truly healthy and impact your community? Go back to your home and say, hey, I'm going to address the diabetes, some of those chronic diseases better. So we provide services with social work. So we have social workers at pretty much all of our sites that can sort of assess the social determinants of health, see where everyone is, and how can we better serve them, and where does the person want to begin? Because it could be a variety of things that they're experiencing, but where do they want to begin? The other part of that is having integrated behavioral health services and at our sites that can, so if we have a patient that we know is experiencing high stress or anxiety or depression, and one of our providers has noted that, then we can right there at our site do a warm handoff to a licensed behavioral health consultant that can, work with that person in addressing some of these needs. If they need to be referred out, which we often do, we have collaboration and partnerships with many organizations in the communities. That's what we do. We're not trying to do everything ourselves, but collaborate and partner with those people that are experts in those areas that can help them. So if someone needs a higher level of care that we cannot provide, like a more intensive behavioral health program, then we look out, we connect them and follow up, which is really important, making sure that they actually get the services that we're referring them to. And then come back and say, okay, well, how is there something else that we can do? So what's the next step that's going to help you really enhance your life to better and become better and healthier and happier, whatever that is for that person, whatever that looks like, we're there to support them and create the systems to support that.
So what are some of the challenges, the biggest challenges in our community in addressing some of these issues? I know for a while we've had higher blood lead levels than even Flint, Michigan, in Lancaster, Pennsylvania. So that's, I mean, those are certainly one of the major issues. What are some other that really stand out as being what we need to focus on here in Lancaster City and the county?
So definitely from a public health perspective, blood lead is something very serious. It has lifelong impacts, especially on children, on their ability to learn, on their long-term health. So, just very, very critically important that we continue to remain focused. We have to also look at our air quality. Again, from a public health perspective, our air quality compared to other communities is not as good as it needs to be. And the impact on air quality and overall health, rates of asthma, the toll that can take on cardiovascular health. So very, very important that we look at that. So those are, for example, public health concerns that as a community we need to focus on. But especially, I think, it's always critically important for us to look at both, who is benefiting and who is impacted the most. And we can look at it for health conditions. We can also look at it for access to care. So, as we, especially right now during the COVID-19 pandemic, looking at who has access to different services, and are folks getting who's most disproportionately negatively impacted by the disease, and do we really put a focus on that community for things like testing and vaccination. So I think it's important to look at things globally, but then to also take a deeper look and say, do we have differences? And those differences may be race, ethnicity, they may be language of origin, background, maybe geographic. So folks that live in parts of our county that have, 25 miles to go in order to reach a usual source of care, that's a disproportionate impact. So, that's something that we as Union Community Care are constantly looking at. So we look at the global picture, but then we take a deeper dive, because part of our mission and our purpose is to spark equity. So we are constantly looking at, is there a difference? And if there's a difference, where can we put our efforts to minimize the negative impact of that difference? So it might be providing mobile services, us getting out to where the community is versus expecting them to come to us. It might be special programming. It might be different initiatives in different languages. It might be, getting better at providing services to certain underserved communities. So, equity is the lens that I think makes us different. And it's something that is core to who we are.
Mhm.
I saw on your website, you do some mobile pop-up vaccination sites. Is that right?
Mm-hmm.
What is your vaccination effort looked like throughout, and your COVID response looked like from the beginning? I know early on we talked with you all, and I think Hourglass was able to share out a message from you that said, even though there's a pandemic going on, we're still maintaining our normal operations of caring for folks and providing traditional care. And so you've been able to do that. What does this look like for the past year and a couple months?
Yeah, I mean, we really took a proactive approach from the very beginning. So in Lancaster City, for example, we were the first folks to provide COVID-19 testing, and we were the first to begin contact tracing in our region. And it's a partnership. It takes everyone working together: hospital systems, local government, nonprofits, healthcare. But we really understood right from the start what our role is as community health. And community health is an action arm of public health. So we had experience in training for public health preparedness. And one of the things we've been training for every year in public health preparedness is pandemic flu. So when COVID-19 hit in our community, we understood what the right public health steps were, and we began to take them. And we believe that our proactive approach has assisted in saving lives, without a doubt, without a doubt. Early testing, contact tracing, it's saved lives, and we're really proud of that. And now really pivoting towards vaccination, our pop-up clinics, and I'm going to let Jackie talk a little bit more about them, but the pop-up clinics take that very, very directed lens, right? So we're not we have a wonderful mass vaccination initiative in Lancaster and Lebanon, and it's just that mass vaccination, which is so important. And so we take the more directed approach. So we then look at who are the communities that maybe that's not going to work for them, or they're a little bit more afraid of the vaccine, or they just need a little bit more information. And so then that's where we bring our services through pop-up vaccination. So whether it is working with a restaurant, or whether it's working with employers, we try to get out to where folks are and eliminate some of those barriers. But Jackie has really been the champion of this work, and I'm excited for you to hear directly from her about our pop-up vaccination work.
So for us, looking at, so we look like at the big picture and say, okay, so we have mass vaccination centers that are going to really focus on all those people that really want to get vaccinated. So I always sit back and go, okay, so now who are those people that are going to be hesitant, that may not have the access to get to the mass vaccination sites? And that's where we need to be pushing the message that, you're vaccinating not only for yourself, you're doing it for your family, and you're doing it for your community. So messaging is important. The right message with the right language. We have a variety of languages. We want to make sure that people understand what the message is, why they're doing this. So that's a big part of what we do. But the other one is really getting out to the people and getting out to those hard to reach communities, whether it is the Plain community in northern Lancaster, the little church on the side of the road, or going to some parts in the city, the high risers, where there's more concentrated poverty, where we can, put up a vaccination event, talk the language, have people that, you feel comfortable talking to. Those grassroots efforts are being made to making sure that everyone is vaccinated. So we're going out, we're vaccinating the homeless, we're going to churches, community meals, the Water Street Rescue Mission, employers. So it's a combination of where we know people is going to be harder for them to really not only have access to the vaccine, but have that hesitancy. So we are there talking to them and explaining to them the value of them getting vaccinated. And I think we're very successful. Our rates are pretty good. And sometimes we have hundreds, sometimes we have 5. And that's okay, because that's the purpose, is to really get to those hard to reach communities. And we're very creative on how we do it.
Great. Glad to hear it. What would be your message to someone who might be hesitant to receive a vaccine? How do you work with those folks? I know that there's logistical issues sometimes and all that. How would you talk to somebody who might be a little hesitant?
I think the first thing is to acknowledge that they're right. Because if you're afraid, there's a reason. And if you might be distrustful, there's a reason. So, this is not a situation of, trying to make people feel like they're not intelligent or not aware, because that's not true. So whatever you're feeling is okay. Absolutely okay, and we respect it. And all we'd like to do is maybe just give you a little bit more information from a trusted source. So that trusted source are our clinicians, our physicians that live in this community, who have done the research on this vaccine. And, we provide that information. It's local. So not everyone necessarily connects with the CDC or connects with, Dr. Fauci. But, we have our local experts, our local physicians who born and raised here in Lancaster and Lebanon. And, we use them as the source for local information. And then we talk about other people that you may know in your community, in your block, who got the vaccine, and how did they feel and how did it go? So again, trusted sources. So, we really come from a place of validating where people are and meeting them where they are. So sometimes they do want more information, and sometimes, when they're ready, we're here. And so, taking that local approach, I think, is really important. Trusted sources, and validating that, regardless of why you feel it, there's a reason why, and that has merit.
Well, that is a really refreshing take on just having a equal communication with folks. Is just that's so refreshing, and I think really important. So wonderful. Well,
and that helps build confidence. When you take the time, to go, to answer those questions, those concerns, and say, hey, yeah, I can see how you feel that way, but these are the facts, and these are this is the reality, and this is how we can help you get your family back together, and have a picnic in your backyard because all your family is vaccinated, or get back our community to a normal sense of normalcy. And when they hear that it's coming from the heart, it's not, anything superficial, they like that. And, you're validating their feelings, you're helping them build confidence. And what I see in the front line when we go to vaccination centers is people that are very grateful that we took the time to talk to them, and that we took the time to go to them instead of expecting them to always come out. And they're grateful that we can do that.
That's great. Yeah, I know for me personally, being able to hug my mom on Mother's Day was like the highlight of my year so far.
Yeah.
So important stuff.
Those are the stories we hear. Absolutely.
Yes. Well, Alisa and Jackie, thank you so much for taking time to talk with me today. Just appreciate the work you all are doing in our community. And thanks again.
Thank
Thank
you.
you, Jonathan.
Appreciate it. Bye-bye.